So good morning, ma'am. So I'm Anjik Tituba. I'm from BSN 1. So I'm going to demonstrate the oral care. So good morning, ma'am. So I'm Anjik Tituba, and I will be your student nurse for today. So I will be the one who will assess you on the oral care. So can you please state your name, ma'am? Okay, how old are you po? So when is your birthday? So the purpose of this, ma'am, is to keep your mucosa clean, and also for your teeth to be always clean, and also to avoid or to prevent a oral infection. So if the door is open, we're going to close it for the patient's privacy, and also the window and curtains, it is open, we need to close it. So let's just say that I've already done with the hand washing, because it is the better one in performing hand hygiene. So let's just say that I'm already done with hand washing. So I'm going to use a alcohol for the hand hygiene. So now we're going to gather all the equipment that we will be needing. So I have here a towel, a cup of water, a gauze pad, a dental floss, a MSS basin, a toothpaste, a bristle toothbrush, and a cleaning gloves. So now we're going to the procedure. So we're going to assess the patient to a comfortable position. So ma'am, can you please sit po?
Kulang po kami, kasi kulang po. Kung you can remove po your blanket po.
Next, we're going to apply the towel to the patient's chest. So ma'am, lagay ko lang po sa chest mo. Next, we're going to apply a cleaning gloves. So dapat both left and right hand ay nakasuot yung glove. Yung left hand naman. After that, we're going to get the bristle toothbrush. Then we're going to wet it. Konti lang. Basta mabasa siya. Then next, so we're going to get the toothpaste, and we're going to put a small amount of toothpaste. Then let's just hand the patients with a cup of water to rinse his mouth or to wet his mouth. So ma'am, by holding the basin below the mouth of the patient. So ma'am, rinse mo lang po yung mouth niya. So after that, we're going to brush the teeth of the patient. So we're going first to start brushing your teeth in the sulcular area where it is in the front. So we're going to brush the patient's teeth both up and down. Then the inner and outer surface of the patient's teeth both up and down. Untas mo lang po yung buka mo lang po yung buka. So just be gently and slowly when brushing the patient's teeth. And also the side of the patient's teeth, both up and down.
Then next, we're going to brush the tongue of the patient. Labas na po yung dila niya. So when brushing the tongue, just be gently and slowly to avoid gag reflex.
So, going to hand the patient with a cup of water.
Then ask the patients to gargle and rinse her mouth. Then ask the patient to spit it to the emesis basin.
After that, we're going, so using the paper, the towel in the patient's chest, we're going to
Assess or wipe the mouth of the patient.
So next, I'm going to get the dental floss. So the purpose of this is para malinis yung teeth ng patient, and also to remove the bacteria na nakasingit sa kanyang teeth.
So ma'am, buka mo lang po yung buangan. So we're going to floss the patient's teeth both up and down. Slowly lang until it reaches the gum line.
Then next, we're going to again hand the patient with a cup of water to rinse her mouth.
Mag-gargle ka po. Rinse mo po yung mouth nyo. Then ask the patient to spit it to the emesis basin.
Then next, we're going to discard or remove the gloves that we've used. Then, assess the patient to a comfortable position. So, ma'am, gusto niyo pong nakahiga o nakaupo lang? Nakaupo lang ba? So, we're going to discard or remove the towel that we've used. Then, again, we have to apply a clean gloves. We're going to remove the things that we've used or yung mga i-dispose or yung need na i-dispose. So both hands must be in a glove. Then we're going to remove and dispose the things that we've used. So this dental floss, this glove, we're going to dispose this to the moisture-proof bag or to the disposable bag. And also the waste that the patient spit to the emesis basins, we're going to throw it or tatapon natin siya. So let's just say that I'm in the naitapon ko na siya. So again, we're going to dispose the gloves that we've used. Then next, we're going to perform a hand hygiene. So let's just say that I've already done with the hand washing because this is the better one done using alcohol. Then next, we're going to gather all the equipment that we've used. We're going to place it in a proper placement. again, we need to perform a hand hygiene. Then next, we're going to document all the data that we've used. If ano yung ginawa natin, if what is the procedure that we do. So that's the procedure or return demonstration on the oral care. Thank you. So good morning, ma'am. So now is I'm going to demonstrate the cleaning of artificial denture. So first thing that we need to do is we're going to apply a gloves. So both hands must be in a glove. So if the patient cannot remove the denture, so we're going to get a gauze pad. Then we're going to help her or him assess to remove the denture to his mouth. So let's just say that we already removed the denture of the patient. So we're going to place it to a dry surface. So next we're going to get the toothbrush. Then we're going to wet it kahit konti lang basta mabasa siya. Then we're going to apply a small amount of toothpaste. So you can also use a soap when cleaning the denture of the patient or the denture. And also, we're going to, I'm going to wet the denture. Now is I'm going to brush the denture of the patient. So when brushing the denture, by moving backward and forward, both inner and outer. So I'm going to clean it with a water. So if you are using a sink, dapat fill mo siya ng water. But I'm using a basin, so I'm going to clean it into the basin. So, ano nga ba ang purpose nito? Why did we fill the basin with a water? Para if there are possibility na ma-drop mo yung denture, hindi siya ma-damage and also ma-avoid yung contamination. So, we are done with the cleaning of artificial of the denture. So, I'm going to put it back in the patient's mouth. So, if the patients don't want to wear or cannot wear the denture, so we're going to put it in a container with a water. Then label it with his or her name and also the number for the identification. Next, we're going to discard the gloves that we've used. Again, perform a hand hygiene, and also don't forget to document if may na-observe tayong abnormalities sa denture of the patient, if may na-observe tayong rough, sharp, or redness in the patient's denture, and also sa teeth if there are any changes of color. So we're going to document it. So that is the return demonstration of the cleaning of artificial denture. Thank you.